Hey everybody, it's time for Avian First Aid, episode 14. This episode is about prolapse.
Prolapse. What a prolapse means is that the tissue is sticking out of where it should be. Usually in a bird, you're talking about the cloaca or the uterus or intestinal prolapse. It's usually in the back end, and it's usually secondary to some other problem because they're usually pushing too much, and that's what makes the prolapse happen. So peritonitis or inflammation in the abdomen can do it. Chronic egg laying can get them too fatigued and dilated, can do it. If they have a hernia, anything that makes them strain. Diarrhea, tumors, papillomas, all those things make them strain, and they're constantly straining, and they can push the tissues out that should stay in. A cloacal prolapse is far less serious than uterus or intestines. The cloaca is the little structure that sits just inside the abdomen that holds the fecal material and the urine until they're ready to go to the bathroom. Then it just everts and goes back in and empties them out. So that structure doesn't hang down very low and isn't as likely to be super painful as if sometimes the whole uterus hangs out or intestines hang out. Those are particularly bad because they are prone to getting self-mutilation by the bird, like they chew them, or they don't have to be out very long and they get too dry and the tissue dies. So what you want to do if you see that is you want to keep the area moist, and KY jelly works really well because it sticks and it moistens for a longer period of time. And you want to prevent further trauma. So if it is a bird with an intestine hanging out, you probably want to hold it, because just climbing around in the cage, the nails can rip that, because it can hang down like that far. And if they rip it or if the tissue dies, then you probably have a dead bird. So it's really important to maintain that. And that would be something that you would want to get it organized and get it somewhere where it can be replaced. What we do when those arrive is assess the health of the tissues and then put them back where they belong, basically. If it's a cloaca, that's fairly easy. You can usually do it with a thermometer with KY jelly on, because it just sits out and you put it back in. Now what's happened if it's out for a while is that the muscles around the vent are so flabby that you put it in, the bird stands up, out it comes again. So what we do in those is we put two little sutures on each side of the vent where you can still get a thermometer in so they can still poop for about 10 days to allow the muscles to come back to normal. If it's a uterine prolapse, those are quite a bit more involved to get back in, because you have to get it in the cloaca and then it has to find its little duct and go back up where it belongs. Some of those, if the tissue is too bad, you might end up spaying them, because if you put dead tissue inside a bird, that's not useful. And an intestinal prolapse, to be honest with you, I have never saved them. Usually they're too difficult to get in, and when you're trying to replace them, the tissue is so thin that they just tear. It isn't that you wouldn't try, but that's quite bad news if it's the intestines that are prolapsed. So what you would do to try and prevent that is prevent the secondary problems that made it happen in the first place, right? So if you notice your bird doing a lot of straining, get it looked into. If they have parasites or papilloma or something, try and get that dealt with before it progresses to a prolapse. Cloacal prolapses are not difficult to deal with, but sometimes it starts as a cloaca and then becomes something else. So if you can address what the offending cause is and get that under control or prevent it in the first place,